I'm Dr. Paul Tachi, and we're going to do a cystoscopy and insertion of a left ureteral stent today here at Imperial Point, along with left extracorporeal shockwave lithotripsy. The patient is a 68-year-old white gentleman who's got at least 3 stones in his left kidney. He's been having pain and blood in his urine, and he's going to undergo lithotripsy to clear him of the stones. It's significant in that he's had previous lithotripsies in 2000 and in 2002 when he had formed stones. He's been stone-free up until recently. The patient, as I say, has been having pain, so we will do this procedure, and I'll leave a stent in, and tomorrow in my office I'll go ahead and remove the stent, and we'll get an x-ray and see how he's doing at that time. Yeah. I'm cystoscoping the patient. I'm putting this through the penis into the bladder. Here we're coming right up to his prostate gland here. We're going through that, and we're into his bladder now. So what we're going to do now is put a guide wire in, and then over the guide wire I'm going to put a stent in. This is his bladder. Right there is the opening of his ureteral orifice where we're going to put the tube. Yeah, put some we're going to pass this little wire, little catheter, and then through that we're going to put a guide wire up to the kidney. So now we're going to pass a guide wire through this up to the kidney. Go ahead and let me see here what we're doing. Okay. Good. We're putting the wire up now to the kidney, and then over the wire we're going to put a stent in. Let's keep going. Good. Okay. We're going to go ahead and put the stent now over the guide wire and push that into the kidney. Good. Oh, it's going. Good. Okay. And get the pusher. Is the wire up, Jane?
Yes, it is.
Okay, good. Okay, I'm pushing the stent up to the kidney now through the ureter. Okay, good. We have the stent in, and now I'm going to take the cystoscope out, and we will have a string coming out the patient's penis.
Light off, please. Light off.
Right on. And then tomorrow in the office I'll be able to just pull the string out and remove the stent. Okay. Good. Put the stent in, and now we're treating the patient with lithotripsy. Yeah, the stones, there are 3 stones here in the pelvis of the kidney. And we've gone ahead and treated 2 of them. The patient is receiving shock waves to the stone, and 2 of the stones have already been blasted. You can't see them very well. We're on the 3rd stone right now. This is exactly where the stent is. And by the time we're finished, this stone should be broken up completely into sand. And then tomorrow, when the patient comes into my office, I'll pull the stent out, and then he'll pass all the fragments on his own. We're also going to give the patient some Lasix at the end of the procedure to help him pass the stones. We're going to treat about 600 more shocks, so we're almost done. We just finished the procedure. The patient tolerated the procedure quite nicely. This gentleman came in, he had approximately 3 stones in the pelvis of his kidney that had been causing him pain and bleeding. We went ahead and put him to sleep. We localized the stones by biplanar fluoroscopy. Went ahead and put a stent in to help the patient, first of all, localize the stones and also to help pass the fragments. The patient received 2,500 shocks. It appears that, as far as we can tell, the stones are all gone. The stent will be removed tomorrow, and hopefully the patient will do extremely well.